So good afternoon and welcome to the dedication and installation of the Marilyn Meyerhoff Professorship in Thoracic Oncology. We're just incredibly grateful that you've been able to join us today by all the various electronic means. And we've added a link to the program for the whole procedure today in the chat for you to download so that you can share it with others who may not have been able to hook up with us today. First, order of business, I wish to extend a welcome to the president of the Johns Hopkins University, Ronald J. Daniels, and to the dean of our medical faculty and CEO of Johns Hopkins Medicine, Dr. Paul Rothman, and to the Alex Grass Professor in Oncology, Dr. David Ettinger. Next, I would like to extend a very special welcome to Marilyn Meyerhoff and her life partner, Sam Feldman. To Marilyn's sister Joyce and her family, to Marilyn's children, Tom, Jack, Karen, and their families, to Sam's daughters, Lee, Dean, and their families. Marilyn, what can I say? Thank you for your incredible generosity in endowing this professorship for which we are dedicating this afternoon. I also wish to welcome the inaugural Marilyn Meyerhoff Professor, Dr. Julie Brahmer, her husband, John Ludica, and their children, Emily and Matthew. We were just talking with them. He'll be attending Julie's alma mater, Creighton, next year. The Julie's parents, I think, are with us on FaceTime and can hear this, Carolyn and Russ Brahmer and their extended family. Julie, I can't think of a faculty member here more deserving of being the inaugural recipient of the Marilyn Meyerhoff Professorship. I've been fortunate to watch Julie traverse all the landmarks of her growth into the greatest thoracic oncologist in the world, in my opinion, a true leader in thoracic oncology internationally. Since she came out of our fellowship program here and joined our faculty in the year 2000, she hasn't looked back, creating changes in the way lung cancer is treated that have been adopted all throughout the world. And my colleagues today will highlight many of her remarkable scientific achievements, I assure you. I wanted to share with you a perspective that I particularly find inspirational personally. I believe that Julie embodies the best of the grounding in Midwestern values. She's humble, practical, impeccably honest, incredibly hardworking, and always willing to lend a helping hand. I grew up in a small rural area with a lot of farms around it, not that far from St. Louis, Missouri, about 2,600 population. It wasn't even a city, it was actually called a village. Julie grew up in a smaller area in Wisner, Nebraska. Population in 2010 was 1,170. Her family is known in Wisner, let me tell you. They homesteaded there in the mid-19th century, and Julie's early years were spent on the family land. Her father, Russ, is a sixth-generation farmer. She spent her summers, and those of you who don't know this part of the world won't even know what I'm talking about, but she spent her summers detasseling corn. Turns out the tassels are the male part, the silk's the female part, and you got to prevent pollination if you want to make the right kind of corn. And by the way, Julie, it is better out in the middle of the country than it is here in Maryland. The corn just tastes better. And she also, did walking of the beans. I'm not going to justify that at all. That's just a lot of work. I can tell you that her early education was modest and practical. She attended the same one-room schoolhouse that her father, grandfather, and great-grandfather attended. At the age of 12, she received a driver's license so she could traverse the 20 miles to town for middle and high school. And her high school did have a 4-H club and an FFA, and I believe Julie may have been a member of both. I venture to say that this origin story has a lot to do with shaping the kind of person that Julie is today. She is the consummate physician scientist, and watching her move our commitment to thoracic oncology built on the shoulders of folks like Dave Ettinger, who's here today. She drove clinical research, managed a busy clinical practice. She's a destination for anyone with lung cancer for all across the country and the world. And training the next generation of oncologists is just the kind of thing that we'd like to see in our faculty, particularly those that we consider for an endowed professorship. Yep, this is what she's done her whole life. I suspect she knows what hard work is. She knows how to do it. And I, for one, am grateful for the kind of leadership she's supplied here as a role model and as a leader throughout the Kimmel Cancer Center. So today is a very exciting day for the Kimmel Comprehensive Cancer Center because an endowed professorship provides the stability and flexibility needed for our faculty to take full advantage of all the important opportunities in research and innovation. The importance of an endowed professorship just can't be overstated. Often it is the critical determinant of maintaining continued excellence as we move forward. And we know for sure that Julie will continue in her own humble way. She isn't going to brag about it. She's just going to get it done to further the mission of excellence at Johns Hopkins. Marilyn Meyerhoff's philanthropy is humbling and inspirational in every way. Her commitment to Johns Hopkins and the Kimmel Cancer Center can be felt across our campus in spaces dedicated to patient care that she's named. And along with her life partner, Sam Feldman, the research and patient education they've initiated for thoracic cancer patients and their families, the whole package has been incredibly helpful and remarkable. And at this time, I would like to invite Marilyn Meyerhoff to unmute and share a few words.
Hello, everybody. I am honored to name the professorship in thoracic oncology and to celebrate with Dr. Julie Brahmer as the inaugural recipient. I am so proud to be part of such an amazing institution as the Johns Hopkins, and I see this as a gift of a promise to help to rid the world of cancer, lung cancer. So congratulations, Julie, and best wishes to you and your colleagues on their important endeavor to cancer research excellence.
Thank you so much, Marilyn. At this time, I would like to welcome Dr. Paul Rothman to introduce and present the Marilyn Meyerhoff Professorship in Thoracic Oncology to the president of the Johns Hopkins University.
Thank you, Bill. And it is an honor to be here today and to be able to connect two great people and two good friends. So it's wonderful to be part of this today to celebrate the dedication of the Marilyn Meyerhoff Professorship in Thoracic Oncology and the installation of Julie Brahmer. I never thought I'd be out Midwestern by Bill Nelson, but I guess today I will be. Thank you for teaching us so much, Bill, about what you do in the Midwest. It's great to hear from you. I'm also pleased to have Ron Daniels, president of the university, to be with us today. Thanks, Ron, for joining. So I'll begin first with Marilyn and Sam, who I've got to know as dean here. They are two very, very special people who just bring a special life to the institution because they celebrate each other in life all the time. And Marilyn, your contributions have been so important to us. And it's just great to see you. We just saw you down in Florida just a couple of weeks ago, it felt like. And it's great to be here today to celebrate this and to thank you. Thank you very much for your generosity, especially when it comes to giving a professorship to Julie Brahmer today. You know, these endowed professorships are really important for faculty. They give them money and resources to do special things that they otherwise wouldn't be able to. And it also demonstrates to the faculty the importance to the institution and gives us some stability for their finances. It is rare to get a chair and a professorship, and to get one from the Meyerhoffs, especially Marilyn, and it is really special. And that's great because Julie's a very special person. Julie, I know when you go back and look at your career and think about the impact you've had on people with thoracic tumors, it is pretty remarkable. You know, my own mom passed of lung cancer, and the problem is that your impact was not felt early enough to save her, but it is really affecting thousands of people. Lung cancer today is not the death sentence it once was, and it's really due to you and many others, but to the work that you pushed forward over your career here. And so you should be very proud. And it really, for me, it's an honor to be able to celebrate you and help provide this endowed professorship to you. So thank you on behalf of your patients and the institution and the patients that are saved by all the work you've done. So as Dean of Medical Faculty, I want to present to the President of Johns Hopkins, the Marilyn Meyerhoff Professorship in Thoracic Oncology in the Sidney Kimmel Comprehensive Cancer Center. Ron, this endowment is held by the University trustees, and so I'm going to formally present it to you. Thank you.
Well, thank you, Paul, and good afternoon, everyone. I'm really delighted to join you today for this wonderful occasion. And of course, feel really fortunate that we have with us the professor's namesake, Marilyn Meyerhoff, and her life partner, Sam Feldman, along with their families, as well as today's recipient, Dr. Julie Brahmer, and her family. And I also want to welcome, as Bill referred to a few moments ago, the several extended Brahmer family members dialing in all the way from Wisner, Nebraska. We're thrilled that you're all with us today. But as Paul indicated, this is a formal moment and I have a formal obligation. So I want to make sure that I requite that responsibility. I have to make Dr. Brahmer's new title official. And so on behalf of the Johns Hopkins University, I accept the Marilyn Meyerhoff Professorship in Thoracic Oncology with great enthusiasm and gratitude. Now, as many of you may be aware, Marilyn Meyerhoff is a great devotee of theater. So it only felt right to begin my remarks today with a nod to one of the titans of musical theater, Stephen Sondheim. I was thinking in particular of Sondheim's award-winning musical, Sunday in the Park with George, about the 19th century French painter, Georges Seurat, whose pointillist paintings were created out of thousands of meticulously applied brushstrokes, which together produced stunning monumental works that changed the world of art. As the show famously begins with a virtually empty stage, and the only person present, at least in its first iteration, is Mandy Patinkin, just a couple of years before his iconic appearance as Inigo Montoya in The Princess Bride, who sings the show's first line. And that line, and I promise not to sing it, is this: white, a blank canvas, the challenge, bringing order to the whole. Now, almost immediately, that challenge is met as the show's cast begins to populate the stage and bring it to life. And I recall this moment because I think it is an apt metaphor for what Marilyn has done for so many physicians, artists, and performers across the country. Over the decades, her generosity has provided the canvases for brilliant people to create remarkable innovations that have made and continue to make our world fuller, healthier, and more humane. Indeed, Marilyn's impact can be felt all across the Eastern Seaboard, from Massachusetts to Florida to her hometown of Baltimore. In our city, her philanthropy extends from her longstanding support of organizations like the Center Stage Theater, the Visionary Art Museum, and LifeBridge Health to Johns Hopkins and the Kimmel Cancer Center. These contributions include, of course, today's professorship, which I have no doubt will be a new canvas for its inaugural recipient, Dr. Julie Brahmer. As you've heard, Dr. Brahmer is a superlative physician scientist who has devoted her life to treating some of the most dangerous and deadly forms of cancer. And she has proven time and time again that with the right canvas, she can bring order to the whole where there was none before. For decades, as you've heard, Julie has been instrumental in reducing the mortality of lung cancer across this country. And not only has she been a vocal advocate for more and better screenings for the disease, her early conviction in the possibilities of immunotherapy treatments for cancer have made Dr. Brahmer among the pioneers in developing anti-PD-1 therapies to treat lung cancer. Like Georges Seurat, she and her colleagues have gathered and assembled countless data points from patients and the results of thousands of experiments to form a picture of how to fight lung cancer in the 21st century. And we don't have to look far for proof that it's working. Her meticulous research has led to FDA approval of the first immunotherapy drug in lung cancer. And it's not understatement to say that because of Julie, lung cancer for many patients today is not the death sentence that it was when people contracted this disease in the past. Marilyn and Sam, of course, know this firsthand, having eerily both walked into the Thoracic Oncology multidisciplinary clinic at Hopkins Bayview with stage 1 lung cancer and left with a treatment plan that has allowed them to continue living full, healthy, rewarding lives. And this was possible thanks in no small part to what Julie and her colleagues have created at Hopkins. So Julie, thanks to you, the canvas for lung cancer treatments is no longer blank, but is being filled in more daily because of your extraordinary and ongoing work. And we're so excited to see what you will accomplish in the years ahead. And Marilyn, thank you again for your continued support, your devotion to our institution. We, and indeed all the patients who benefit from your generosity, are profoundly, profoundly grateful. To borrow once more from Sunday in the Park with George, you both have kept us moving on to make something that counts, not only for you, but for all whom you serve. Congratulations again, and thank you.
President Daniels, thank you for joining us today and for your remarks. And now it is my distinct pleasure to introduce Dr. David Ettinger. Dr. Ettinger serves as the Alex Grass Professor in Oncology, a Professor of Oncology, Gynecology, Obstetrics Medicine, Otolaryngology, and Radiation Oncology. As many of you may know, Dave came as a fellow in our cancer center in 1973, when the cancer center itself was located on the campus of what we now call the Bayview Hospital. At that time was Baltimore City Hospital. He joined our faculty in 1975 and has been a dominant figure in our ecosystem ever since. He has mentored several generations of oncologists, including me and Julie. And as he will tell you, his commitment to caring for cancer patients and their family is at the center of who he is and what he is all about. So it is my honor to welcome Dr. David Ettinger.
Thank you, Bill. Thank you for inviting me to be part of this wonderful occasion. It has been my great pleasure to know Julie Brahmer for 22 years, initially as a mentor, but always as a valued colleague. Today, Dr. Brahmer is a professor of oncology, director of Thoracic Oncology program, co-leader of the Cancer Immunologic program, co-director of the Precision Medicine Center of Excellence, and director of the Sidney Kimmel Comprehensive Cancer Center at Johns Hopkins Bayview. In 1989, Dr. Brahmer had received her undergraduate degree in chemistry and philosophy from Creighton University in Omaha, Nebraska. In 1993, she received her MD degree from the University of Nebraska and began her internship and residency in internal medicine at the University of Utah, where she served as chief medical resident from 1996 to 1997. In 2000, Dr. Brahmer became a fellow in medical oncology at Johns Hopkins. As she was interested in lung cancer, I was doing clinical research and seeing patients with lung cancer. I became her mentor. Dr. Brahmer's research interest included leading early phase immunotherapy trials of anti-PD-1 antibody, phase 3 studies of immunotherapy in lung cancer, and investigator-initiated trials evaluating epigenetic therapies in combination with immunotherapies. She is a member of the Sidney Kimmel Comprehensive Cancer Center Immunotherapy-Related Toxicity Management team. In addition, Dr. Brahmer co-leads guidelines for immunotherapy toxicity developed for these national and international organizations, the American Society of Clinical Oncology, the National Comprehensive Cancer Network, and the Society for the Immunotherapy of Cancer. Dr. Brahmer is very active in lung cancer patient advocacy groups, such as Longevity and the Lung Cancer Research Foundation of America. It has been my great pleasure to share with you the trajectory of Dr. Brahmer's career and her many accomplishments. She has been exemplary in each aspect of her career at Hopkins, and I look forward to her continuing contributions to the study and treatment of lung cancer, to the lives of her patients, and to the support of her colleagues, and to this institution. It is always also my great pleasure to be able to say, as Dr. Brahmer's mentor, that my mentee has equaled or surpassed her mentor as a clinician, lung cancer researcher, and patient advocate. That is the way it's supposed to be. Thank you. And I would like to turn it back to Dr. Paul Rothman.
Thank you. Thanks for those kind words. Julie, you are very special, and we have a memorial to give you. I think, Shannon, can you show it to her? Or, oh, you have it. That's great. This is just a way, Julie, to ensure that you always remember this, and your obtaining of this the Marilyn Meyerhoff Professorship in Thoracic Oncology. It's again, we are so happy to have you, and so lucky to have you and treat the patients you do here at Hopkins. So congratulations.
Well, thank you very much. It's a remarkable day for my family, my patients, and our thoracic oncology team at Johns Hopkins. I would like to recognize and thank President Ron Daniels, Dean Paul Rothman, Dr. Bill Nelson, the Kimmel Cancer Center Director, and my mentor, Dr. David Ettinger, for their support of my receiving of the Marilyn Meyerhoff Professorship in Thoracic Oncology. I'm humbled and inspired with this honor that Marilyn Meyerhoff has created at Johns Hopkins. Marilyn and her life partner, Sam Feldman, have been tremendous advocates for our thoracic oncology program for over the years. Their support has helped us to advance our knowledge in the field of thoracic malignancies, which has resulted in many publications and changes in practice. Now, Marilyn's support gives us further inspiration and the ability to laser focus on the next barrier, immunotherapy resistance. Thank you so much. It is such a great honor to have a professorship named after a woman who is so accomplished and such an inspiration. Today, I want to honor my roots, my family, my mentors, and my team, my Hopkins family. My roots run deep in the Nebraska farmland. Growing up on a farm, I learned the value of hard work and being respected by your community from my father. My love of medicine was sparked by my mom, who is a nurse, and her selfless caring of others. To this day, regardless of how she feels, she's always caring for others. I have been blessed by having the most amazing and supportive parents who are also my best friends. I'm also blessed by my wonderful and supportive husband, John, and my two children, Matthew and Emily. They endure the late nights, late calls, and a wife and mom who wears many different hats. Thank you for your love and support, as I love you all dearly. We're all touched by cancer in some way. In high school, my grandfather was diagnosed and passed away from non-Hodgkin's lymphoma. His death inspired me to learn more about cancer, and as a senior, even wrote in my high school yearbook that my life's goal was to cure cancer. Little did I know what that really meant. My mentors in oncology all inspired me to take great care of our patients, and it is a privilege to help folks through some of their darkest hours. Also, by watching their example of pushing the field to improve survival for cancer patients and defining extraordinary care for them as well, I have learned how to be an oncologist and a clinical researcher. Starting with Dr. Julie Vos, who first introduced me to clinical research in medical school at the University of Nebraska, and who still inspires me to be a great leader in oncology. Dr. David Ettinger, who you heard from today, introduced me to the field of lung cancer when at the time there were few female role models. He opened doors to opportunities for research with his colleagues around the world and introduced me to the women oncologists in lung cancer research. His clinical acumen, frank but caring style, and his quick wit taught me many things throughout our time together. He also pushed me to hone my skills as a writer, and I appreciate his editing skills to this day. I have to thank the late Dr. Abeloff for taking a chance on hiring me, Dr. Balin for his guidance in all research matters, Dr. Liz Jaffe for her empowerment of our women researchers and scientists, and finally, Drs. Drew Pardal and Suzanne Topalian. When I met Drew and Suzanne, my goal was to bring a first-in-human drug into the clinic and then help develop it into one that would get FDA approved for lung cancer treatment. Little did I know the folks at Medarex and then BMS that they introduced me to would make that dream a reality in order for me to play a part in that process. Drew and Suzanne taught me all that I know about immunology. They handed me an opportunity of a lifetime, which I took, and showed me how to push an idea even when a company was ready to turn its back. Thank you, as I appreciate your mentorship and partnership as we have so much more to do. During the trials of that first in human drug that is now known as nivolumab, I met many patients who have become friends and mentors as well, including Mr. Gobin, Mr. Ryan, and Mrs. Martyr, and many more that I'm not able to name today. Their selfless courage to take a chance on an unproven drug really showed me what courage and faith is all about. My patients inspire me every day to improve their care and learn more how to make their lives as best as possible. Lastly, I want to pay tribute to our thoracic oncology team. I believe one is only as good as those you surround yourself with or be a part of your team. One team member I owe so much to is Sarah Sigorsky, my physician's assistant. I hired her right out of school. Over the past decade, her clinical prowess and insight into patient care has eclipsed any advanced provider I have worked with. She shoulders many of the day-to-day patient care, always with a smile and I've got this attitude. I am eternally grateful. At Johns Hopkins, we have a great thoracic oncology team. We work together to solve problems in the clinic, in the lab, and across disciplines. Our amazing multidisciplinary pulmonary, rad-onc, med-onc, and thoracic surgery faculty, nurses, clinical staff, administrative staff, and research staff who stretch across our campuses come together and really have made us the premier place to get thoracic cancer care. I am proud of our team and accomplishments. As others have mentored me, I take serious the job of mentoring others. I am so proud of our faculty and trainees who are part of our program, who I have had the pleasure of mentoring, including Dr. Patrick Ford, who is transforming the care of patients with mesothelioma and early stage lung cancer. He is now my partner in leading the thoracic oncology program. Others include Ben, Elsa, Christine, Kristen, Joe, Joy, Susan, and Vincent. I couldn't be prouder of our thoracic oncology faculty. We make a great team. The future of our program is bright. So I owe this accomplishment and recognition of our work to all of these people, and I dedicate the Marilyn Meyerhoff Professorship in Thoracic Oncology to my roots, my family, my mentors, my patients, and my team, our Hopkins family. Thank you so much for this honor.
Thank you, Julie. And at this point, ladies and gentlemen, it is my distinct pleasure to present to you the inaugural recipient of the Marilyn Meyerhoff Professorship in Thoracic Oncology. And Julie, I would like to present you with this, and you actually get a chair. Here it is. I'll present you with this chair that we will send to you as the inaugural recipient of the Marilyn Meyerhoff Professorship in Thoracic Oncology this 13th day of May on 2022. Congratulations. More applause is due that. And of course, all of us look forward. Oh, yeah. All of us look forward to a time, hopefully not in the too distant future, when we can get together and personally thank Marilyn and Sam and share this honor, Julie, with you, John, and your family. So on behalf of the Kimmel Cancer Center, thank all of you for joining us today, being part of this dedication and installation ceremony. It's truly a wonderful day for our cancer center, and I'll bet we look back and lung cancer, for as long as any of us can remember, has been the leading cause of cancer death in our country and throughout the earth. And perhaps this is the beginning of the end of that trend. And I hope it will be. And Julie will be a part of it. So thank you all for joining us today.